Hi, everyone. So today we are going to be going over managing PTO tracking. It's time off to kick spreadsheets to the curb. So in this webinar, me, your product specialist, I'm going to break down the common questions revolving around PTO, vacation, and sick leave, and how you can start effectively tracking time off while saving money. So I just want to let you know that I'm super excited to talk about this feature with you. We at HR for Health use the software ourselves. So from an employee perspective, I can tell you that tracking time off in HR for Health, it's super user-friendly, intuitive, and one of my favorite features in the software. So let's take a look at our agenda. So we're going to be going over some common questions, common types of time off, common ways people track benefits, how time off tracking works within HR for Health. We're going to also do a demo and a Did You Know segment, and we're going to end everything with a game. So for those of you who are just joining us for the first time, here at HR for Health, we can help you do HR like you've never done before. Of course, we specialize in HR software for non-HR people, but that doesn't mean that we don't also work with seasoned HR experts to help make their process a little easier. Our mission is to be your compliance partner and to ensure a safe and positive workplace for your employees. As a result, you will save money, save time, and improve company culture, and of course, avoid lawsuits. So let's jump in. Before we jump into the actual software and how time off can be tracked, let's take it back a little bit and go over some questions surrounding time off and help provide a clear understanding on how aspects of time off work. So the first question that we often get from clients is, what is the difference between paid time off and vacation leave? Paid time off covers any paid time off away, whether the employee is taking vacation, a mental health day, a sick day, or has jury duty, things in that nature. Vacation is specifically paid time off for just that, a vacation. And typically you will have stricter rules surrounding requesting time off in a vacation policy, specifically since there are many states that have rules around sick leave. Next is, what is the difference between an anniversary year benefit and a calendar year benefit? Is one easier to track than another? Anniversary year benefits usually start and renew on an employee's anniversary date. Calendar year benefits usually start and renew on a specific date, for example, January 1st, and will run through December 31st. There are both pros and cons to both methods. So for example, anniversary year, employees will not be confused as to when they are eligible. So this is a pro. There's also less work needed by the employer to explain what it is. If you are tracking within HR for Health, our time off system works seamlessly with anniversary year time off tracking, and there is no need to prorate hours. The cons of an anniversary year, if you are currently tracking time off on a spreadsheet or any manual method, it may be a lot of work to keep up with anniversary dates in order to manage unused hours for each employee and switch employees into new time off categories. So obviously the easy solution would be to switch to HR for Health so we can track all of that for you. Calendar year, the pro with the calendar year is everyone is on the same timeline. So like mentioned before, everybody's starting on January 1st and then ending on December 31st. However, there are some cons. So if you have an employee who's joining your practice or your business mid-year, you do have to prorate hours. And then also, if you pay vacation out at the end of the year, you will have to pay everyone out all at once. This can definitely be a financial burden. The next question is vacation mandatory? And the short answer to this is no, it is not mandatory. However, it is encouraged to promote employee retention. How soon should I start providing vacation? While you can choose to pay vacation as soon as your employee starts or after a probation period, which typically we recommend is 90 days, most smaller practices start providing vacation time to their employees after 1 year of employment. What time off benefits do practices normally provide? It is important to understand the difference between PTO and vacation, as we mentioned above in one of the previous questions. Once a client understands the differences between PTO and vacation, they tend to choose a vacation and sick leave time off bank versus PTO. Next, we're going to go over some accrual and lump sum questions. So what is an accrual method versus a lump sum method of time off tracking? The accrual method is where an employee will earn time off based on the time worked. This can be accrued per hour, per day, per week, per pay period, per year, or per month. This is something that can be set up in HR for Health. Lump sum is giving the employee all the time off hours at once, also something that can be set up in HR for Health. We make the tracking easy, and time off banks are tied directly to our time clock for work time off tracking. So what this means is as the employee starts using our time clock and clocking in, they're able to accrue those hours accordingly. What is an accrual cap and a usage cap? This question typically comes up for clients in California who have an accrual and usage cap for the California mandatory paid sick leave. An accrual cap is the amount of time an employee is able to accrue within their benefit year. So for example, an employer may allow an employee to accrue 48 hours, and once they accrue the 48 hours, they cannot accrue any more for that benefit year. A usage cap is the amount of time the employee is actually able to use within that benefit year. So for example, they might be able to accrue up to 48 hours, but they may only be allowed to use 24. I know this seems overwhelming, so luckily our software actually can accommodate this as well, and we track it on our end in our software. Next, we have common leave types. So it is very common and types of requests that we get from employees. So it is very common for employers to offer some form of paid time off, vacation, or sick leave. And of course, some states require employers to provide sick leave and have their own set rules governing how those should be set up and how they can be used. There are different categories of leave that an employee can request time off for. So vacation, PTO, paid sick leave, leave for COVID-19 was very common, bereavement leave, and other legally protected leave of absences. All of these leave types are available for documentation purposes in HR for Health. So when an employee is actually requesting time off, they can choose the type of leave. It is important to track the process from the initial request down to the approval and denial of time off. In a case any questions arise from the employee, and proper record keeping ensures you are paying the employee for the correct number of time off hours, rather than facing a situation where you are overpaying or even worse, maybe underpaying. This can typically happen if you're tracking things manually. So common ways that employers track time off is through word of mouth, post-it notes, emails, and spreadsheets if they're not using software, which isn't always the most effective or compliant way. If you are using a method outside of a software, you are likely spending a ton of time keeping up with employees' time off balances, deducting time off hours, switching employees into a new benefit tier when it's time for them to earn more hours. And if you have employees on an accrual, making sure that you're updating those balances each day, week, month, it's very time consuming. There's also a huge possibility that there's human error that will occur. HR for Health is the solution to ensuring that you are tracking time off for your employees and ensuring that you're tracking it in a compliant manner. So we're going to actually jump into how it works. We are going to go ahead and break down the simple steps by going over the handbook, setting up time off banks, how your employees will use the time off, and resolving the time off. We will then go into a Did You Know segment where we're going to break down using the management level time off and some filters. So let's go ahead and jump into the software. Go ahead and sign in here. All right, let's take a look at our employee handbook. So the first step of tracking time off in HR for Health is to ensure that your handbook has policies clearly stated. When using HR for Health, one of the first things you complete while onboarding is your new industry and state specific handbook. Right here you can see our handbook software. You will complete it within the handbook software, and you will start with our questionnaire. The questionnaire is going to ask you questions regarding your policies that you currently have in place. This includes questions regarding your time off, the time off you provide, who it's provided to, how much is provided, if the employee accrues it over time or if it's a lump sum, And after that questionnaire is completed, you are able to review the policies that our software has generated for you. You can also edit those policies, add your own custom policies, and remove policies. And the perk of using HR for Health is you also have the option to choose for automatic law updates to your handbook. So this is one less administrative task that you have to worry about. And once you have reviewed your policies, you are technically ready to go with that handbook. It can be sent to your team. So you do have the next step, which is the third step, which is to add it to your new hire checklist. That way it can be sent out to all your new hires anytime you have somebody come in. It is also great for transparency between employer and employee. An employee will know what time off benefits are provided to them and how those benefits are accrued, and what happens to those benefits at the end of the year or upon separation of employment. So taking a look here, we are on step 1, which is that questionnaire. You can take a look at the questions that we ask. So do you provide vacation? If the answer is yes, you're going to get subsequent questions. So is it based on calendar or anniversary year? We chose anniversary year. How far in advance do employees have to ask for vacation? We can plug in 2 weeks. Is it provided to full-time or part-time employees? So on and so forth. So all of the information is within that questionnaire. We then take that answer and we put it into a policy. So if we go to the next step, we will see step 2, and we can actually review that vacation policy that we have completed. So really you're just plugging in your answers. We are putting them into our template. This is all compliant. You also have the option, of course, to add your own policy, or you can make edits to that policy that we have created. Once you are ready to send it to your team, you've reviewed everything, you can go ahead and click the next button. You're able to add that directly to your new hire checklist, and you can send it out to any of your existing employees. So we click save, and then after we click save, we can send it out to our team, and then we get some confetti. They're really fun. The next thing we're going to go over is the second step, and that second step will be when our team is actually creating those different time off things from your handbook policy. So we'll go to wage and hour, benefits, and here we have some templates here just for the purpose of this demo. This ensures that your time off banks are consistent with what is stated in your handbook, and you can add as many time off banks as you would like. So if you offer different types of leave, such as vacation and a sick leave policy, those can easily be documented. You can also have different time off tiers. So maybe your employees receive 40 hours of vacation from year 1 to 3, but maybe from years 3 to 5, they get 80 hours. And if you have an employee that has different time off banks than what's actually stated in your handbook, you are able to set those up as well. We usually refer to those as grandfathered benefits. You will then assign your employees to all the time off banks that are applicable and the different time off tiers. This is beneficial because once the employee hits year 3, for example, they will automatically be enrolled into their new time off bank. There is no manual action needed on your end and no time spent updating a spreadsheet, recalculating how many hours they should have now, and no accidentally forgetting to update your employees' time off. Lastly, when you're adding your employees to the time off bank in HR for Health, you are also able to input the number of hours that they currently have if you've been tracking them in another place, like an Excel spreadsheet. This will ensure that you start using HR for Health for tracking time off. Your employee doesn't actually have to start from the beginning. They can start from what their current balance is and accrue time off based on that balance and what they've already earned. So here on this page, you have the different names of the benefits, the different categories. Again, this is all set up by our team. All they will do is show you how to assign your employees. You have the details of the benefits. So here you can see this one is 1 to 2 years of service. Each employee will earn 0.02 hours per hour worked. So based on our time clock, so as they clock in, they'll get 0.02 hours per hour. You can see that they are able to earn 40 hours for this tier, 80 hours for year 2 to 5, and then 120 for 5+. And then assigning employees is super simple. Under actions, you click assign. You can see the details of the vacation benefit, and you're able to select the employee's name. Once you select the employee's name, if they currently have a balance, you're able to type in what that balance should be. You can do a date as of. So for example, maybe I have 10 hours as of last Friday, and I can go ahead and click save. Next, we're going to go over employees actually using the time off. So we'll go to timekeeping, time off, and I'm going to choose one of my employees from the drop-down. This is going to bring me to their details page. So once an employee is assigned to their time off bank, they are able to track their time off within HR for Health software. They will be able to see the time off bank that they are assigned to, how much time off they have earned, how much they have taken, and all the requests that have been submitted, as well as the status of those requests. This allows for even more transparency and allows for employees to effectively plan out when they want to take a vacation based on how much time they have earned. Employees will no longer need to reach out to you or your office manager to figure out how much time they have left on that spreadsheet or within a different system. And when an employee needs to take time off, they can request that time off within the software. That request will send an alert and an email to the employer or manager, and the employer or manager can approve or reject that request. Once it's approved or rejected, the employee will receive an alert letting them know that it was resolved. So taking a look here, we have the details, we have the name of the benefit that they're assigned to, we have the benefit range, the number of hours taken and hours remaining. We also have the request down below. And requesting time off is so simple. All they do is click request time off. They're able to put in that reason. So for example, vacation. As an authorized user, you will have an extra step here, which is to deduct from a time off bank. So I am currently logged in as an authorized user, so I have this option. So for example, I can choose paid sick leave or vacation if I had any hours. I don't, I'm just gonna go ahead and select that NA option. I then choose the date. So for example, maybe I wanna take the 13th off. I can click apply. I would add in the number of hours and if I want that request to be paid or not paid. I can also add some additional details. So employees will add in a comment of why they're asking for this. So vacation to just say Disneyland and click save. So because I'm an authorized user, this was automatically approved. However, if I was an employee only, this would go to attention required. It would then be pending for the authorized user to approve or deny that request. Next, we're going to go over what to do with those time off banks at the end of a benefit cycle. So if it's a calendar year benefit or an anniversary year benefit, HR for Health has made the process simple with their time off resolution feature. At the end of an employee's time off cycle, whether the time off bank is anniversary or based on calendar year, HR for Health software will alert you when it's time to resolve the employee's unused time off hours. The authorized user will receive an alert and email letting them know their employee has unused time off that needs a resolution. The authorized user is then able to manage the time off by either rolling over those hours, unless they have opted for an auto rollover, which is another perk of using HR for Health. When setting up the benefits, we can actually choose to auto roll over those hours, so there's no attention needed on your end. We also can pay out the hours or forfeit the hours. And to ensure compliance and continuity, HR for Health includes an easy reference link to your handbook to ensure you are following your office's policies when resolving the time off balances. It's super important that you do so. So what does that look like? So here you can see there's a little triangle where an action is required. I can click on that and it's going to take me to the history tab and it will show me the action is required for 2 benefits that need to be resolved. I can easily click the manage icon. I can review the benefit itself. So this is for vacation. I can reference my handbook. So if I click this link, it will pull up my handbook. And just a quick tip, you can Control F and type in, or Command F and type in vacation. And it should take you specifically to all of the places where vacation is outlined within the handbook. Then I can review a breakdown of the unresolved hours calculation. So how many hours were earned, rolled over, added for this year. And I can see the total number of unresolved hours is 40. From here, I can take my action. So I'm going to roll these hours over. I can choose which benefit I want to roll it into. And then I can go ahead and leave a comment if need be and resolve it. And once it's resolved, you get confetti. Next, we're going to go ahead and go over some little things that we have incorporated into our software to make accomplishing your tasks easier. Today, I want to highlight two things within our software. And the first is our time off feature from the management level. So if we go to wage and hour and we go to time off, it will bring us to our management level time off section. This is where department heads will only see the employees that they have access to based on their permissions, and they're allowed to review their time off from here instead of having to go into each individual employee's account. So they can see the employee name, the type of leave, the date, number of hours that were requested, the status, and of course they can take action. They can also use our filtering options, which a lot of places within our software, a lot of features within our software have filters. So they can filter by employee, by date range, and by status. And a little quick tip here, you can filter the headers. So if I wanted to change the list view for employee, I can click employee and it will change. I can also do it for type. So if I wanted to see sick leave first, I can choose that. If I wanted to switch it up, I can do vacation first. Also, date is one that can be filtered, hours and status. All right, we're going to go ahead and hop back into our deck here. Let me go back to presenting mode. And we're going to do a quick game of true or false. So here's some good information for you guys. Again, is it mandatory to give your employee vacation? The answer to this is false. It is not mandatory, but it is encouraged as a method of retention. Paid time off and vacation are different. This is true. Paid time off covers any paid time away where vacation is specifically for a break. You should have your time off policy stated in your handbook. This is true. This makes it easier to stick with a consistent process and makes sure you are operating compliantly. HR for Health's handbook software will ensure your time off policy is well documented in your handbook. I can cap the amount of paid time off my employee is allowed to take in a year. This is also true. Usage caps can be placed on employee benefits. A common benefit that has that usage cap, again, is that California paid sick leave. And HR for Health software can accommodate usage caps when setting up a benefit. Next is HR for Health allows for transparency when it comes to employees' time off. This is true. Not only will your employee receive a copy of their handbook that states their time off policies, but they have access to their time off banks, so they no longer need to ask you how much time off they have before requesting for a vacation, or of course, sick leave. All right. And with that, we hope you learned something new about time off and time off tracking. If you are struggling with time off management and are not currently using HR for Health, we encourage you to reach out to us. Time off tracking does not need to be a stressor. And if you have any questions that you left in the comment section, we will be sure to get back to you with those answers. Thank you again for joining.